BDR-19 critical care ventilator is different than other ventilators introduced due to the COVID-19 pandemic. From inception, the BDR-19 was designed to be low cost and easy to operate, to be manufactured in high volume without bottlenecks, and to be reliable, rugged, and easy to maintain. Yet the BDR-19 achieves all of this without compromising capability, and it is designed and manufactured for years of operation, well past the pandemic. The BDR-19 provides a full spectrum of ventilatory support throughout each phase of treatment, from partial support through mandatory life support. And it provides invasive and non-invasive ventilation. Compared to other ventilators in its class, the BDR-19 is the easiest to use and has the quickest training time by far, which is of vital importance during surge use and stockpiling. The controls are instantly viewable on the front panel, and there is no need to page through numerous screens and prompts in order to adjust settings. The BDR-19 has 3 modes of operation. These include bilevel positive airway pressure, or BPAP, which includes a backup rate, pressure regulated volume controlled ventilation, or PRVC, and continuous mechanical ventilation, or CMV. The display screen provides real-time information for breath rate, inspiratory pressure, mean airway pressure, PEEP, delivered tidal volume, and minute volume. When selecting a mode, LEDs clearly prompt the user to set the needed controls for that mode. For example, when setting CMV mode, you are prompted to set PEEP, inspiratory pressure, rate, IE ratio, FiO2 setting, and high and low tidal volume alarm limits. Likewise, when selecting the PRVC or BPAP modes, LEDs will guide you on which controls need to be set. CMV mode is a pressure-controlled mode that delivers mandatory breaths at the set inspiratory pressure, PEEP, rate, IE ratio, FiO2, and high and low tidal volume alarm limits. Breath delivery results in a smooth lung pressure waveform, with a gentle rise time and a stable plateau pressure, without overshoots or undershoots. CMV mode can be used when the patient is dependent on mechanical ventilation. Of note, the BDR-19 ventilator has an internal oxygen blender, and the FiO2 can be set at 21% and from 30 to 100% in 10% increments. Importantly, the FiO2 setting does not influence the other controls, and the other controls do not influence the FiO2. With some other ventilators, oxygen has to be bled into the ventilator circuit, causing the user to resort to additional procedures and equipment to determine the FiO2 setting. And the FiO2 level can fluctuate based on how other controls are set. The BDR-19 FiO2 control is independent of other controls, which facilitates convenient, safe, and effective use in the ICU critical care setting. PRVC mode is a volume-controlled, pressure-regulated mode that delivers mandatory breaths at the set tidal volume, PEEP, rate, IE ratio, and FiO2. For mandatory breaths, the user sets a desired tidal volume to be delivered by the ventilator. The user also sets a maximum allowed inspiratory pressure for additional safety. The patient can also trigger an assisted breath in this mode. For these assisted breaths, the user sets the assist sensitivity setting. If the patient has a spontaneous breath effort that reaches the set value, the ventilator will deliver the set tidal volume. The timing of mandatory breaths will be synchronized with the assisted breaths and the patient's own spontaneous breathing efforts. PRVC mode is very useful to begin to wean a patient off of being dependent on the ventilator. In BPAP, a continuous flow is delivered to the patient at the set PEEP level. When the patient draws a spontaneous breath, the pressure level is raised to the inspiratory pressure support level. This mode can be used as supportive ventilation with an intubated patient or a patient with a non-invasive mask. If the ventilator does not detect a patient's spontaneous breathing, a mechanical breath will be delivered based on the set backup rate, PEEP, PIP, and FiO2. If the patient then begins to breathe again, the BPAP mode is restored. This important backup function conforms to the highest critical care ventilator standards. The BDR-19 has a full complement of alarms, including user-adjustable tidal volume alarms, and will automatically set PEEP, inspiratory pressure, and rate alarms. It also includes an apnea alarm when in BPAP mode. The BDR-19 uses commonly available universal dual-limb patient circuits. A proprietary circuit is not required. The expiratory limb attaches to a built-in exhalation valve, which accurately and reliably helps regulate pressure throughout the breathing cycle and controls the PEEP pressure during the expiratory phase. Pressure at the patient Y is constantly monitored through the proximal pressure line attached to the proximal pressure port on the front of the ventilator. A slight purge flow keeps the proximal pressure line free of water. All connections are compatible with standard bacteria filters, and the exhalation valve is easily replaceable after each patient. The BDR-19 ventilator uses best-in-class components from world-class suppliers. Some other ventilators have been designed so that it is difficult to diagnose problems and even more challenging and expensive to repair or replace. The BDR-19 changes that. All subsystems are easily accessible to make it easy to maintain and service. The BDR-19 ventilator, including its custom software, was developed according to the FDA's design control regulations. The device is being rigorously tested by certified independent laboratories per the ISO 80601 ventilator standard and the IEC 60601 electromedical equipment standard, which are globally recognized by leading regulatory authorities, including the FDA. BreathDirect will provide a 1-year warranty, extended service plans, and offer annual recertifications if requested by the customer. Simple maintenance procedures can be performed by the hospital clinical engineering department according to instructions provided by BreathDirect. Factory service will be offered for more complex repairs. For customers purchasing ventilators as surplus safety stock, such as stockpile, BreathDirect will help make sure your units are properly maintained and patient-ready at all times. BreathDirect will provide training programs, technical support manuals, and 24/7 phone support to make sure you have all the assistance you need to confidently incorporate the BDR-19 into your ventilator policies. The BDR-19 is a breakthrough system for government agencies, medical facilities, and institutions needing to resource critical care ventilators for times of increased demand, and an optimal solution for COVID-19 related ventilator shortages in the US and worldwide. With its comprehensive features for delivering a full continuum of ventilatory support, intuitive controls, simple training requirements, and easy serviceability, the BDR-19 ventilator has been purposefully engineered to meet the critical surge demands of today and be an optimal solution for your patients' respiratory needs for years to come.